Tom from Zero to Finals. I'm going to go through some basic heart anatomy and physiology to just recap before you set your finals and before we tackle some bigger topics such as how to read ECGs. So the heart is essentially a pump. It's an elaborate pump that allows blood to flow from the body round into the lungs, pick up oxygen, get rid of CO2 and so on, back into the heart and then round the rest of the body. That's its job. In order to coordinate that pump so that it just doesn't sort of contract randomly and to make it as efficient as possible, it has an electrical system that coordinates all the muscles together. So we're going to go through those today and have a look at all of the different components and how they work. So to start with, this is the basic anatomy of the inside of the heart. So we've peeled off a layer of muscle here and we're looking at the different chambers. So it's got 4 chambers, right side and left side. So the right atrium, right ventricle, left atrium and left ventricle. Blood flows from the venous system back into the heart via the vena cava. So it's got the superior vena cava from everything above the heart and the inferior vena cava bringing blood from everything below the heart. This flows into the right atrium where it sits in here until the right atrium contracts. When it contracts, it ejects the blood through the tricuspid valve, which allows the blood only to flow in that direction, and into the right ventricle. And from here, the right ventricle contracts and sends blood off into the pulmonary artery. Artery meaning taking blood away from the heart itself. Once it's travelled round the lungs, it comes back via the pulmonary vein into the left atrium where it sits here. When the atrium contracts, it travels through the mitral valve into the left ventricle, and then when the left ventricle contracts, it travels through the aortic valve up into the aorta, around, off into the body. Okay, so that's the pump system. The atria contract together, pushing blood into the ventricles, and then the ventricles contract, pushing blood into the lungs or to the rest of the body, depending on the side. Okay, so that's a very simple overview of the heart anatomy. So this essentially is the function of the heart, but in order to produce this function, it needs to have a supportive system. So the first system that needs to support it is the heart itself has to have a blood supply, and that's done by the coronary arteries. So here we have a diagram of the outside of the heart. You see this is the aorta. Blood is pumped into the aorta from the left ventricle, and a couple of little branches off the aorta. One is the right coronary artery, which supplies the right atrium primarily and some of the inferior portion of the heart. On the other side you have the left coronary artery, which splits early into the circumflex, meaning going around, and that supplies the posterior and lateral area of the heart. And then you have the other branch, which is the left anterior descending, which supplies some very important areas of the heart, like the left ventricle, the septum. So that's a very essential, important artery. Okay, so now we've covered that, we need to cover the electrical system of the heart, which is what allows the pump to coordinate effectively. So here we have some key structures. This is a sinoatrial node. It's the pacemaker of the heart. This is where all the electrical signals start. Then we have the atrioventricular node. This is to slow down the passage of electricity from the atrium to the ventricles, and this allows a delay that lets the atrium effectively pump blood into the ventricles before the powerful ventricles contract and eject blood out into the body, into the lungs. So they're the 2 nodes. Then you have the bundle of His, which is what takes the electrical signal from the atrioventricular node down into the septum. Then you have the right bundle branch and the left bundle branch. So these are electrical branches that take the electrical system on the two different sides of the heart through the septum, and then you have the Purkinje fibers, which are these little fibers that take the electrical system into the actual muscle itself and cause a contraction. So electricity starts here in the sinoatrial node, travels down, enters the atrioventricular node where there's a delay. This lets the atrium contract and pump the blood into the ventricles. Once that's happened, the electrical system is shot off from here into the rest of the ventricles, and this causes ventricular contraction, which is, the end of the story really, the end of systole. Fine. So what you can see is that in this system, the electrical signal essentially flows in this direction. So I hope this video is useful. There's loads more resources on zero2finals.com, including loads of questions that you can use to consolidate your knowledge and test it. I hope you'll find it very useful, and I'll see you there.